Welcome to the first episode of Coronis Cast, a podcast provided by Coronis Health. Today, we've got Abby Arnold, one of our clinical subject matter experts. Abby brings a wealth of knowledge in the clinical and practice space to the Coronis team. And on this episode, we're going to take a deep dive into the challenges of owning or managing a pediatric behavioral health clinic. So I'm going to hand it over to Abby to share more about her background, and then we'll jump right in.
Awesome. Thanks, Kate. So like Kate said, I am a pediatric occupational therapist by trade. I had the opportunity to start my training in a pediatric multidisciplinary clinic. At that time, I was granted the opportunity to open one of our branches and move into the business side, which I quickly fell in love. From there, I was able to manage a multidisciplinary, multi-site location, and from there, I learned a ton about the business side. I would say I was kind of thrown into it, but with that, I was able to learn a lot on the job and kind of really understand how your billing and insurance and the revenue cycle plays an impact and part of your financial health, but really there are many other aspects that actually roll into that.
Thanks, Abby. Yeah, as Abby said, I think as an RCM company, most folks just think that revenue cycle and financials within a practice or a clinic are just talking about the billing or the insurance piece of things. But in reality, as an RCM business partner, it's never just about the billing or just about submitting claims to insurance. In fact, it's really more on how do we focus on improving, streamlining, and making processes overall more effective when it comes to operations and how the business functions. And once we really dive deep into those and get things running efficiently, that's where we find our clients really start to see overall positive financial health. So as Abby said, it's never just about the RCM piece. There's also the business side of things as well, and everything's kind of interwoven. So today we're going to explore some of the business challenges of owning a pediatric behavioral health practice. Not surprising, you're going to see some of these challenges are also relevant within other specialties and are just business challenges that anyone involved or owning, managing a physician practice, a clinic, or any provider groups face. So, Abby, let's talk about the first challenge.
So I would say the first challenge is something that you kind of see across the board in all practices, basically because of the changes in insurance reimbursement, and that would be productivity of your clinical staff. So that plays a huge role. Obviously, you're selling a service, and that service is providing, whether it's therapy, providing some sort of medical work, but you're providing that service. And so without having that service, you're not going to actually bring in any money. And so really looking at the productivity of your staff is really important. But I would say one area that people spend a lot of time on is the clinical side, because that is where you bring in the money. However, you really need to take a step back and look at your administrative side too, and really make sure that you have allocated your administrative staff where they need to be. You have the right people doing the right job. I think that's also an area that kind of is impacted on the medical practice side, but also that the people that are doing the job, you have the right amount of people doing that job. You're not running somebody too thin, or you have too many in that position. So I think looking at the productivity of your entire company is really critical when you're running your business.
So are there ways that you like to measure that productivity? How often do you like to measure that? Can you talk more about that?
Yeah, so I think that's an important KPI for your business. On the clinical side, it's obviously a lot easier to run that productivity. I think running it on a weekly basis is important. You can definitely pull that out of your software system or your EHR that you're using. With that, though, I think a lot of medical practices probably see this where they run their productivity, say, on a Monday or Tuesday once the charges are all in from the week before. And then you meet with your executive team, say, Tuesday or Wednesday. You make changes, you roll that out, and you're already a week past the week that you are reviewing. So it's really trying to manage when you're going to run that productivity and the changes that you're going to be making sure that you're making changes in a timely manner. As far as the staff side goes, I think that's something that you can definitely run it on a weekly basis, but it may not be as pertinent as the clinical side goes. So I think definitely revisiting your monthly staff productivity is important on that monthly basis.
Okay, thanks. What about the second challenge?
So I'd say the second challenge is staff and client retention. So staff retention is really important, and it's a competitive space in healthcare, going along with the productivity. So if you have too harsh of productivity standards or your staff can't keep up with that productivity, you frequently lose those staff. Also, with the low margins between what you're billing out and what you're actually bringing in, it is important for you to understand that you may not be able to offer those high salaries or compete with some of those bigger businesses, but what other areas can you bring to the staff that's important? I think culture is huge in healthcare. I think every employee wants to feel valued. And so really looking at what are some of those areas that you can bring in to your staff that don't just rely on salary? And then also client retention. Without clients, you can't provide the service. And so I think client retention is very critical. You want to make sure that you are bringing clients in, and when you're bringing clients in, they're not sitting out in the waiting room waiting for 20, 30 minutes. You also want to make sure that you're following through with the client. And then another thing that I think sometimes practitioners get into, especially on the therapy side, is when is an appropriate time to discharge, and not keeping the clients on too long, but really setting those expectations from a clinical side on when is it appropriate to discharge your clients.
Great, thank you. What's next?
So I would say next is, and this is where the RCM side comes in, is the front desk training. So when you are running your business and you have somebody on the phone taking on new phone calls, getting the clients entered into the system, getting them set up for an appointment, 10, 15 years, that was just where the responsibility was. But now with the requirements of checking their eligibility, pre-authorization, and making sure that you have everything you need before you see that client, it is really critical for your front desk staff to be trained in the RCM side of things and really understand the importance of that first point phone call. The other important part is your back office staff. So making sure that your front desk staff and your back office staff are talking, and also they're talking to your clinical side. So an experience that I had was, I was a therapist. I was a new grad. I was following through with the guidelines of my company. I was billing, doing everything that I was supposed to be doing, but I never actually knew if the services that I were providing, we were getting reimbursed. I never knew if I was coding something wrong. I never understood what authorizations were until I kind of got thrown into the business side. So I think it's really critical to make sure that your practice really understands the RCM, and it may not be something that you guys want to do internally, but even just having that understanding of how each point of contact with the client really directly impacts the collection process is really important.
Do you felt like in school you got enough exposure to the business side of things and understanding that? Or do you feel like that's an area where providers need to offer some additional education to therapists so that they understand what's happening in the business, what is important, what are the key metrics that they as a provider should be looking at?
Yeah, that's a great question. So I think when I was in school, I think my school did a nice job as far as providing some of those resources, but when you are a new grad, when you hear insurance, you're so scared about, I went to school for this long, I passed the test, I got my license, I don't want to do anything bad to get that license taken away. So like, I feel like as a new grad, like fraud was something that you always worried about. And it's not that any of us go out thinking or that we're going to do that, but it's when you hear insurance like that and documentation, that's kind of, I don't want to say scared because they didn't scare you into that, but that's a big topic of conversation around Medicare and Medicaid and making sure that you are you are providing the clinical skills that you feel are clinically appropriate and not providing things that don't fall in your scope of practice. So I think that's where, as a new grad, that was where a lot of our focus went, and not necessarily in understanding the business side. So I think school is a great time for it to be introduced, but I don't know in that moment when you're learning the clinical side if the schooling would be appropriate and translate into the actual business side.
Right. I feel like the insurance side of things is really almost overwhelming to a lot of clinicians, especially given just all of the reimbursement changes, coding changes, that it can be really challenging to stay on top of all that. So in addition to making sure that you're protecting your license, that making sure that you're staying on top of the insurance stuff, just it's one of those knowledge is power things, and gives you more just more insight into your business as well.
Yeah, so. Absolutely. And I think as a new grad, when you're coming out of school, your focus is getting that job, and you really want to grow clinically. So you're not really thinking of the business side because that's not what you went to school for. You went to school for the clinical side. So I think and that's one thing that I will say in my previous company that made my position so unique, was I was able to learn the business side, but I also had the clinical side. So I understood why it was so challenging around the documentation requirements, and why, it was harder to really have those insurance conversations as a therapist, because you're building that clinical relationship. And so I think it's just it's a fine line that you have to walk, but I definitely think it's something as a business owner that would be really smart to provide to your team is training on the RCM side, because it all connects. Right.
Absolutely. What about the fourth challenge?
So the fourth challenge actually falls into the revenue cycle. So it goes into really understanding the revenue cycle. And I think when you're a business owner and you're looking at the revenue cycle, you think billing and you think insurance. And those are your two main areas that you're really focused on, but really looking at the full picture. So that is one thing at Coronis that we really focus on, is that full picture scope. So really looking at the contracting negotiations. So are you in network with the right providers? Should you be in network with that provider? And looking at the credentialing process. Do you have all of your staff credentialed? Are they up to date on their CAQH? Is their licensure up to date? Making sure just all of those steps fall into place. That in itself is a 2 to 3 person full-time job, just making sure that you're managing the front end. And there's nothing worse than being a practitioner, seeing your clients and putting forth all of the effort and knowing that because somebody didn't click something on a piece of paper, you're not going to get paid for that because you weren't credentialed. Like, there's nothing worse than that. So I think that's a critical step. And then really just that eligibility and authorization piece. So I would say specifically in the pediatric therapy space, with eligibility, so you're seeing these clients, especially on the ABA side, you're seeing them for 20 hours, 30 hours a week. So that's really hard to check eligibility every single time they come in, but eligibility plays such a critical role in getting paid for the services that you're offering. So it's really important to have a strong process around how you're going to check the eligibility, how you're going to verify benefits, how you're going to train your clinical staff on what that eligibility and verification means, because there may need to be a modifier, or there may be a code that's not approved, but from a clinical side, that's the therapeutic code that needs to be built. So that needs to you need to make sure that the patient understands that this could be their responsibility because it's not going to be covered. And then on the authorization side, so many more insurance companies are requiring pre-auth before you receive a service. And if you don't have that authorization, you don't get paid and you can't bill the patient for that. So that in itself, and there's nothing worse than, you're looking at your AR 30 days down the road and you see a client with a $10,000 balance and you're wondering, why is insurance not reimbursing that? And it says no auth. What do you do then? You're stuck. So really just having smart processes around the front end of your RCM and really looking at the full revenue cycle is not just billing and insurance collections is really, really critical.
Do you have a recommendation on how often practices should be checking eligibility and making sure that they're on top of authorizations as well?
Yeah, so at most softwares nowadays really kind of help you set up success for the authorization piece. So you can set it up where you can schedule a session, and if you don't have an authorization, it'll say no authorization. So I think that in itself kind of sets that piece up. But you want to make sure that your therapist and your front desk staff who's doing the scheduling understands when they see that, what is the process that they're going to follow through, because it is your responsibility to get the authorization. So if you don't have an auth on file, what is your process, and making sure that your team's trained well in that so that they can follow through on the patient side.
Right.
And then as far as eligibility goes, on the medical practice side, on the physician side, I think checking it before every visit is critical. On the therapy side, I definitely think checking it on a weekly basis is very important. I totally understand if you're seeing a client every single day, that's challenging to check that. But I think making sure that you're checking it on a weekly by weekly process, that's just good practice.
Good. Thanks for that. And last but not least, what's our last challenge?
The last challenge is patient collections.
That's a big one.
So with the changes in insurance, more and more of the responsibility is going on the patient.
Right.
And so with that, you are asking your patients to be able to pay you for services. And sometimes the deductibles, co-insurance can get up to $5,000, $6,000, $7,000. And not a lot of people have that extra cash laying around for a medical service. So how do you manage those patient collections? And it can be very challenging when you have to put in hard stipulations as far as canceling sessions and moving sessions, because from the therapeutic side and from the clinical side, I'm recommending services, so I recommend that they receive these services. And so it can be very challenging, especially if you're a business owner and you have that therapy background, because you build that therapeutic relationship with your patient. And so it's really hard to overcome that, and that's why it's very critical to have a strong financial policy in place. It's very critical to review that policy with your families. Critical to have what you're going to do for payment plans, how you're going to collect co-insurance. Are you going to have any sort of outliers where, what are you going to do in those situations? I think having those conversations up front, training your team again and making sure that they fully understand those processes is important. And then looking at outside resources. And so that's where at Coronis Health, that's something that we bring to the table. We can put together those financial policies. We can help you do the training with your team. We can help you put in place how to collect money from your patients and kind of remove that therapeutic piece. But we also understand how important that piece is. So it's not something that we lose track of, but it would be better for us to take it than your therapy staff.
Good. That's a big one. That's a big topic right now. So it's a good one to end on.
It is.
Well, thank you, Abby, so much for joining us today and providing some incredibly valuable information on just the challenges that folks are facing from a business standpoint. I think oftentimes providers forget that their job is to not only provide care, but they also have a business to run, and often that can be challenging for providers. So,
absolutely.
So thank you.
Great. Thank you.
Thanks, Abby.